Hello, I'm Dr. Deepika, one of the doctors in the pre pregnancy clinic today. May I confirm your name and age, please? Hello, doctor. I'm Amanda Fernandez. I'm 27 years. Nice to meet you. How would you prefer to be addressed? You can call me Amanda. All right. So, what brings you in today, Amanda? Doctor, I'm thinking about getting pregnant. I have this medical condition called sickle cell anemia. I'm a bit worried, is it really safe to go ahead? Will my baby inherit this condition? I have a lot of questions to go about it, doctor. I really appreciate you coming in today, Amanda. It's very wise to plan ahead, being in the best possible health before pregnancy. Today, I will provide you with all the necessary information and also give you a written information leaflet as well to take home. All right, doctor. Before we proceed, would it be all right if I ask you a few questions to understand your condition better? Okay. Have you had any recent hospital admissions, Amanda? Yes, I was admitted about a year ago with severe pain and I needed some medications and blood transfusions. I'm so sorry to hear that, Amanda. That must have been a difficult time. Are you okay now? Yes, I'm fine. Are you on any regular medication since then? Yes, they started me on this particular medication called hydroxycarbamide. Mm-hmm. And honestly, doctor, it's been like a magic for me since then. I'm really glad to hear it's working well for you, Amanda. Are you currently on any regular blood transfusion regimen? No, I am not. And when was the last time you saw your specialist? Around 6 months ago. Do you have any symptoms at the moment? No, I feel fine right now. Have you had any recent blood tests specific to your condition, such as liver and kidney functions, eye checks, or a heart scan? Yes, they did some tests about 6 months ago and everything was fine. That's reassuring to hear. What about your vaccinations related to this condition? Oh, I'm not quite sure about that. That's all right. If you are happy, I will review your vaccination records. That's fine. Are you currently taking high dose folic acid? No, I'm not. No worries, I'll look into starting that for you. Have you been pregnant before? No. Are you currently using any form of contraception, Amanda? Yes, we use condoms regularly. That's good to know. Are your cycles regular otherwise? Yes, they're quite regular. And how about your partner? Is he generally fit and well? Yes, he is healthy. Has he ever been tested for the sickle cell gene? No, not yet. Can I ask what's your blood group? It's A positive. And your weight for height ratio? 24. Do you have any other medical conditions? No. Any other medications you're on? No. Any allergies, Amanda? No, none. Have you had any other surgeries in the past? No. Over the past few weeks or months, have you experienced any low mood or an anxiety or a depression? No, I have been doing well. And how is the support at home, Amanda? My partner is very supportive. Before we go ahead, what are your expectations from today's consultation, Amanda? I just want to understand how this condition might affect me and my baby during the pregnancy. That's a very valid concern. Could you please tell me what you already know about this condition? Well, I think it affects my blood cells, isn't it? Yes, you're absolutely right. Sickle cell anemia is a condition that affects your red blood cells. It's a genetic condition, which means it is passed from parents to children. Usually, a baby gets one gene from each parent. Since you have this condition, you will definitely pass on one sickle gene to your baby. And if your partner doesn't carry the gene, your baby will only be a carrier. That means they will have the gene, but they won't have any disease or symptoms. Oh, is that so? Yes. If your partner does carry the gene, then there is a 50% chance your baby will have the sickle cell disease like you. That is why we suggest testing your partner, and for which we will make a referral to the genetic counselor. They will help guide you through this. Am I clear so far? Yes, doctor, but I really don't want my baby to suffer like I have, doctor. What are my options if my partner carries the gene? I completely understand, Amanda. That's a very valid concern. In that situation, you have two options. Option one being going for a test tube baby, which is an IVF pregnancy with a genetic testing, where we will refer you to the fertility specialist. The embryos are created outside the body, and only those without the gene are selected and placed into your womb. This way, you avoid passing the condition to your baby. And the option two being testing during your early pregnancy. If you conceive naturally, we can offer you a blood test to look for the baby's gene, or we can do a needle test. These needle tests use a fine needle to collect a small sample for the genetic testing, which is done under ultrasound guidance. Although this needle test is generally safe and straightforward, like any other procedure, it does carry some small risks. There is a less than 1 in 100 risk of miscarriage and 1 in 1000 risk of infection. Having said that, this test gives us very accurate information about whether your baby has inherited this abnormal gene or not. These are your options, Amanda. Oh, okay. You're not alone in this, Amanda. We will support you every step of the way. Alright. Before you plan your pregnancy, there are few important things we need to ensure. Firstly, regarding the medicine you are taking, which is a hydroxycarbamide, which may not be entirely safe for the developing baby. So we usually recommend avoiding pregnancy for at least 3 months after stopping this medication. However, it is important not to stop it suddenly. We will arrange for a specialist review to guide us on how and when safely stop it. Okay. Until then, I strongly advise that you use an effective and a reliable contraception, at least until we get a green signal from your specialist. Am I clear so far? Yes, doctor. We will also start you on the high dose folic acid, which is 5 mg daily, and you need to continue it throughout your pregnancy. I will review your recent blood tests and a heart scan. If you haven't done them recently, we will arrange those, including an eye testing and a testing for certain antibodies, which are proteins that can attack your own cells. I will also check your vaccination records, and based on that, we may need to update your vaccines. In addition to this, we will start you on the penicillin prophylaxis to help reduce the risk of serious infections during the pregnancy. Am I clear so far? Yes. Amanda, would you like to know what pregnancy and care would look like for you? Yes, please. With proper care, pregnancy is usually smooth, but I would like to tell you about some possible risks. For you, more chances of pain crisis, anemia can get worsened, higher risk of chest infections, urinary tract infections, risk of high blood pressure and blood clots. Early delivery is possible. You may need a cesarean section. For the baby, slightly higher risk of miscarriage and possible growth problems. But do not worry, we have ways to reduce these risks. We would involve a team of specialist doctors in your care. You will have more frequent visits, regular scans. You will be booked in a consultant-led care unit. And we will start you on the low dose aspirin to reduce the risks like high blood pressure, and from 28 weeks we will start you on some blood thinners to prevent clots and continue it for 6 weeks after the delivery. We will keep a close watch on blood pressure, urine tests and blood tests. Am I clear so far? Yes, doctor. We also recommend staying well hydrated, avoid extremes of temperatures, avoid strenuous exercise. You need to seek help immediately if you're feeling unwell or you have vomiting or a pain. We will plan your delivery in an obstetric unit. We will aim for a normal vaginal delivery. We will make sure the blood is available. We will take all the steps to reduce the bleeding, and we will also provide you the safe and effective pain relief options. We don't use any pethidine in your case. And we will also give you information about contraception. Preferably an injection called DMPA may be the best choice for you. Any questions for me? No, doctor. Okay, I will discuss your case with my consultant. I will write a referral to your specialist. Thank you so much. Here is your written information, Amanda. Thank you, doctor.